Welcome to Plus Talk on Plus Life, where we are all about turning positive into a plus. Well, the COVID-19 vaccine is here, and the big question is, do you get it? Should you get it? And should people living with HIV get a little bump to the front of the line? Joining me today, my guest, Jeff Taylor. He's the director of the Palm Springs HIV and Aging Project. Hey, Jeff. And Mark King, an award-winning blogger, author, speaker. He was on Out 100's top list last year, and if that's not enough, picked up the 2020 GLAAD Media Award for a most outstanding blog. Gentlemen, thank you so much for joining me.
Thank you so much.
So let's get right to it. We are in the midst of a second pandemic. You both lived through the first one, that being HIV and AIDS back in the day. But here we are. We have a vaccine for this one, finally. Do we take it? Do we have a right to go to the front of the line and say, well, look, I'm HIV positive, I'm immunocompromised? Or are we busy saying, well, you equals you, I'm healthy and undetectable, I'm doing everything I can to tell the world that there's no reason to be afraid of me, so why should I get to the front of the line? Jeff, are you getting the vaccine or are you going to wait your turn?
Well, actually, I'm splitting the difference by joining a trial. That's what I did with the HIV pandemic when there was nothing available. And here where I live, we're not getting bumped up, despite what the CDC had said. So I figured, why not just put my body on the line, be a guinea pig for science like I did before. And that's what I've done. I got my first shot today for the Novavax trial.
You're part of one of the trials. It's interesting you bring that up. I wanted to be a part of one of the trials, and I missed the boat. I just missed out. I couldn't do it. Mark, what's your take on this?
I don't want the HIV community to be seen as monolithic, like we're all sick, we're all vulnerable, we're all immunocompromised, and therefore we should be going to the front of the line. It's about messaging. Obviously, there are people within the HIV community who have comorbidities, they call them. In other words, other stuff going on, which might make them more vulnerable, and therefore, they might need to go up. But otherwise, I want to be careful about our messaging here. The fact is that I am as healthy as the next person. I am not immunocompromised. I have a healthy T cell count, no viral load, and I want to hold on to that. I want to deliver a message that we are as healthy as the next person.
So what do you say then, Jeff, to the people who would argue with Mark and go, yeah, but we also have HIV, and some would say it's an immunocompromised illness. That being said, plenty of doctors all along have said, oh, if you're HIV positive and undetectable, don't worry, you're not at a higher risk.
Well, that's evolving like everything else with this pandemic. And there was a paper that just came out in The Lancet about a week ago now that said that at least in Britain, looking at people with HIV, they were at slightly higher risk. And then that's when they, looked at everything else and the comorbidities and so forth. And just having HIV did mean that there were slightly worse outcomes. And there was a call today with Carl Diefenbach, Division of AIDS at the NIH, who said the same thing. So that's evolving and it's changing. Mark, you're right. For the most part, we're not. But, they're starting to find subtle differences. And, as the research evolves, we'll learn more.
I was going to say, Jeff, and it's not like that we can expect the government to understand the nuances of HIV and those of us with various other issues, right? In other words, they may see us as monolithic, and they got a big job to do here. They're trying to get a virus out to hundreds of millions of people. And so if they tend to overgeneralize a particular population, I can live with that.
Yeah.
But Mark, how do we get the messaging right, though? Because I became a little irate when I found out that people in New Jersey who smoke cigarettes and are obese to the front of the line. Now, I'm sorry, do I need to go and start chain smoking and fly to New Jersey? Like, why is that okay, but this isn't?
Because we have a monumental task at hand here, and that is to get hundreds of millions of people vaccinated. And in that process, we're going to paint with a very broad brush. And yeah, people who are smoking are going to be at a greater risk of having very bad health outcomes because of COVID. And do I want to make this a judgment call about you shouldn't be smoking? Let me tell you something. Judgment has never gotten us anywhere when it comes to HIV prevention. Let's not start now.
How do you both feel about the stigma that surrounds COVID-19? Where all three of us have experienced our own fair share of stigma around our HIV, but there seems to be a new wave of that. And then, like I said, you take things into account when you go, well, he's obese and chain smokes. Why does he get the vaccine? Where is stigma playing a role in all of this, and who gets treated and who doesn't? And how do we avoid making similar mistakes, Jeff?
Oh, that's a tough one. I think Mark's right. You paint with very broad strokes and you go with the information you have and realize that it's going to be, different in different places. And the other layer of this is that we don't have a unified government response, despite what the CDC says at the state level and at the county level. They can do things very differently, and they've already done that here. They had, more vaccines that they needed for healthcare workers because so many were turning down the vaccine. So they opened it up to everybody over 65, but not people with HIV because they wanted to get the older people. So, no matter what we say or do, it's going to end up rolling out the way it rolls out. And, I, for one, am just not going to get too worked up over it because we really have little control. And one reason I decided to take matters into my own hand and join the trial.
Yeah, no, I think and kudos to you, Mark. Going back to the messaging point that you said and how this is presented, what are your suggestions on how one deals with this? Because I think there's a fair few of us out there who are HIV positive, who are undetectable, who go, that, I want the vaccine, and I'm going to do whatever it takes to get to the front of the line.
I would not try to exert ourselves into the front of the line in terms of into a place that we wouldn't otherwise deserve. I mean, leave it to a deadly pandemic to bring out the very worst in people. This is all about people going to the lifeboats at the end of Titanic, right? I mean, we have to have some humanity about this and understand that there are nuances to HIV. There are those of us who are not compromised. Now, here's something. I say I'm not compromised, and I'm all about this messaging, making sure people understand that me as a person living with HIV is perfectly healthy. But will I take the vaccine when I'm invited to? You betcha. And the reason is it's a public health emergency, and I can't, from an ethical standpoint, be guaranteed that if by giving up my place, it will go to someone more deserving. The point is get as many vaccines into many arms as possible. We can do two things at once, and I can continue talking about the fact that people living with HIV can live long and healthy lives.
Yeah, and look, I think we're all deserving, and it is our own individual choice as to whether we want to get that shot. I, for one, am one of those people who does want to get it. When you both look at the speed at which this vaccine, or these vaccines rather, have come out, here we are. I think it was exactly a year ago that we were learning here the first person in Los Angeles, in LA County, was diagnosed with COVID. So we've 12 months. We've gone from that to at least 2 vaccines on the market here, 3 in the UK, more to come. Do you ever stop and go, well, hang on, how come we weren't able to do that with HIV, and why has that taken so long, Jeff?
Well, it's precisely because of HIV. We learned so much during that pandemic, and as we all know, it took a painfully long time, for the government to wake up and do anything, and then to change how that whole process worked. And it was thanks to the advocacy of people with HIV, ACT UP, and others that got changed, that we had this kind of fast track process. And so and it's the same people at the NIH and the FDA who were around back then, who learned from those mistakes, who are in charge now and making this happen as quickly as they can. And I think people should rest assured that they are taking every precaution possible, and it is very safe. People are concerned, but they really shouldn't be, because all the safeguards are in place that would be for any other drug. They've just massively speeded it up because they poured billions and billions of dollars into the process, which is not what usually happens.
Mark, does it give you hope that we could be on the cusp of something that we get shot in our arm that either vaccinates or inoculates?
I don't necessarily apply lessons learned from COVID in terms of the science of it to HIV, because HIV is a much different virus, and the idea of getting a vaccine is a much different job. However, I will say this. The very idea that we're all questioning whether we should get the vaccine or not. This is, again, about messaging and the leadership of this country and the disinformation that we've all received over the years. I mean, I'll tell you, I know Jeff would agree with this. Even in the old days, while we were fighting the FDA for our lives and asking for accelerated access to clinical trials for new drugs, we never questioned the science. There was never any question about whether or not the science was valid. We just wanted it to happen faster. The fact that we live in a world today, in a nation today, in which we question openly the science is so counterproductive, and it's not going to get us where we need to go.
Yeah, you're right. And you know, when you look at where you guys were back in the 80s at the height of the pandemic, aside from a cure that we all want, what, in your opinion, do you feel has changed the most with the way people look at people like us living with HIV? Mark, do you want to take that first?
I think that they might actually be able to see us now as people who can live healthy lives. I have friends and neighbors outside of, my gay HIV type social immediate, I have friends, neighbors, acquaintances that years ago I wouldn't have thought they would know a thing about HIV, who now know that I am living with HIV, and they know exactly how healthy I am. I don't have to answer a lot of ignorant questions that I used to get. So that's the main thing. And the other thing is we talk a lot about a cure, vaccine, these kind of end game sorts of solutions, which I'm all for. But let's not forget that in many ways, I am a living cure right now. I pop my 2 pills in the morning and I'm good. I have a healthy immune system. And unless I cut down on the cigarettes, I'll much more likely die of cancer than of HIV. That's
you
progress.
See, you're going straight. I know you're in Maryland. That's not far from New Jersey. You're going to skip across the border.
We're watching you.
Yeah, we're watching
Fine.
you. Jeff, do you have anything to add to that? I mean, what do you think has maybe not changed in this day and age?
Well, Mark paints a very rosy picture, and in certain circles that's true, but too many places you go, and it might as well be 1981 all over again. People think it's a death sentence. You hear horrible stories of people go to their families and they're not allowed in the house, or if they are, they have to eat off disposable plates and use a different bathroom. So we have a long ways to go. Yes, some segments, and it's like everything else in this country right now, right? There's a lot of privilege. Some people have access to information and understand things, and others are ignorant, they don't have that information, or they're willfully ignorant, which is, I think, even more scary. And it's kind of the sign of our times for the last 4 years.
I got to tell y'all that Jeff just called me out on my privilege, and he's right. In other words, he's right. I need to be called out on my privilege. Sometimes I'm not good at seeing the outside looking in.
I live in a bubble.
But you know what? That's why the three of us do what we do. That's why we created Plus Life, to keep the conversation going. Even if it's just someone going, hey, what does U equal U mean? That can just change. I'd start a whole chain of events. Jeff Taylor, Mark King, thank you so much for giving me your time and giving us your unique perspectives on all of this, gentlemen. As always, I appreciate you. Thank you very much. If you want to hear more about what we've talked about today, or just do a little more research, check out our website, pluslifemedia.com. And remember, you can follow us across social media platforms. We are at Plus Life Media. That's going to do it for today. Until next time, wear a mask, wash your hands, stay safe, and turn positive into a plus.